Today we're welcoming Dom Higgins from the Wildlife Trust to talk about the cost savings to the NHS of Wildlife Trust programmes. Dom's worked for the Wildlife Trust for a while, leading their policy and campaigns in this area. Prior to working at the Wildlife Trust, he was Director of External Affairs at the Conservation Volunteers, where he worked on growing the impact of green gyms. He's also worked for the Department of Education and Skills on the youth and citizenship programmes. He chairs the Wildlife and Countryside Link Nature and Wellbeing Strategy Group, and he does a whole lot of work for mental health programme boards and strategic advisory boards. So he has a lot of experience in this area and shares a lot of that knowledge with strategic decision makers. So we're very happy to welcome him this morning. But just before we start, a word or two about the Outdoor Recreation Network. So our network is to support and encourage everyone to responsibly enjoy and engage with the outdoors. And we're a wide network of members from across England, Wales, Scotland, Northern Ireland and the Republic of Ireland. Next slide, Jane. And this academic research group was set up to help researchers share their insights with each other and also with the people who work in more practice and policy fields. So very much a way of researchers showing the impact of their research, because the researchers can share what they're doing with the people on the coalface, if you like, and people who are working directly with outdoors can talk to academic researchers. So we do these quarterly, we make them online, and contributions are welcome for all sorts of topics related to outdoor recreation, from people working in universities and colleges, research institutions, and sector organisations like the Wildlife Trust today. Jane, can I have the next slide? Just to note, and I will show this slide again at the end, that we've got 3 more sessions coming up. We're doing outdoor environments to promote healthy ageing in December, managing recreational disturbance and responsible use in February, and we do not yet have a topic for our meeting in March. So lots of time to think about that and think, am I doing some research that I want to share in March? If you have any ideas, please email Jane, and her email is there. So I think, yes, I'll now be handing over to Dom Higgins. Thank you very much, Dom.
Thanks, Pippa. Morning, everybody. It's really great to be here, and great to see a good few number of names that I recognise. I believe I'm going to share my screen. Oh, hello. No, it's being run for me. Okay, that is equally good. So I'm sure a number of you know the Wildlife Trust. But just in case not, just a little bit of a quick overview. Also, note that the title of this is Cost Savings for Wildlife Trust Programmes. You'll see as we go through this presentation, this is applicable to any programmes run by any of you and your organisations. Necessarily and corporately, obviously, you know, we've carried out this research, and so there's a lot of promotion around that, but I think it's worth saying that from the off, that you know, these impacts will apply to any one of us. So yep, thank you very much for having me. We are a federated set of organisations. So I work for the Royal Society in the centre, and that is an interesting and often quite a powerful model, where you've got independent local organisations with their own decision-making powers, their own board of trustees and chief executives, and you sort of position things from the middle. And it's particularly useful for health, because health is local, and particularly when it comes to populations. But we do operate to a collective strategy, and this was pulled together online in the good old days of lockdown. And so actually what it meant was all the chief executives and chairs could get together and sign off on a collective strategy, which for those of you that know us is some undertaking, and hasn't really happened before, I would say, in that kind of collegiate way. So goal 1, it's about 30 by 30. It's about nature in recovery and working towards those 2030 goals, where we want 30% of land and sea being actively managed for nature's recovery by 2030. And so a long way to go there. Goal 2, which says meaningful action. So this is about opening up our arms, raising up our heads, and working with communities. There's a headline figure that says we want 1 in 4 people taking action for nature and climate. Clearly that cannot happen just in a set of reserves, just as wildlife trusts. So it's about partnerships, but it's also about our work off the reserves and with people. And then the third goal, which is nature-based solutions. So this is essentially about how we and nature play a valued societal role, both locally, nationally, and sometimes globally. Whether that's around kind of the beaver vision that was released this week, natural flood management, or in terms of improving people's health and well-being and reducing health inequality. And if you see at the bottom of the slide that goal 3 has a success measure based in health and well-being, and all wildlife trusts apply to that. And what's particularly good about this is you are looking at improving health, but also tackling inequality and the results. And we know there are some kind of access issues around that. So if you could move to the next slide, thank you, and click again. So the way we talk about nature and health and well-being at the Wildlife Trust does incorporate those kind of areas. So obviously we're looking at our functioning ecosystems and clean air and all those sorts of things. That middle circle is really around a quality of life. It's around prevention, it's around connected communities and people living in places and neighborhoods and having homes that actually are in nature, are for nature, but also they're adapted to climate change, and people can walk, cycle along and wheel through these places, and they're a lot more kind of focused around that kind of healthy living. And then of course there's the middle part, which is more around what you might describe as nature prescribing programs. And so if we go to the next slide, quite often people look at nature in that utilitarian way as well. And these are some snippets I've picked up from various health professionals over the years. And I was, it's really interesting having come into this sector really as a very little background in anything that one might deem relevant. I'm a drama graduate, frankly. So I'm really fascinated as to what other people's understanding are and where they come at nature. So in no particular order. I've learnt about marker proteins that come out of jellyfish. So there you're looking at what's the word? Green fluorescent proteins that are used in X-rays. I learned that from someone within NHS Ocean Healthcare, and also the fact that the horseshoe crab, whose blue blood is used to make sure that there are no contaminants put in the body when you're having something injected into it, and it was critical during the COVID-19 vaccination program. The fungi, I did learn these from a colleague, but they're just incredible. I know a lot of you will know a huge amount about them, but I think they're endlessly fascinating, and their hyphae, their very fine roots, make anything from bulletproof vests to any other kind of strong material, and also that they can control the weather. In terms of shooting spores out, they're very connected to each other. And the cordyceps, I'm sure we've all seen that David Attenborough clip of the ant being sort of mind controlled to die on the shaded side of the tree so the fungus can live on. And then this last one, the horseshoe crab, this was from David Pension, who was the managing director of the NHS Sustainable Development Unit, if you remember that. Today it's the greener NHS, and they have a chief sustainability officer. But David Pension talked very much about the cone snail, and essentially, anyway, I do work with a lot of health partners. One of them is the National Academy of Social Prescribing, and they summarise really what the public health role of the environment sector is. I'm sure I am really preaching to the converted here, but it's probably worth just reinforcing and remembering that it's, there are many ways, and people who have control back over their lives, who live in a neighborhood where they can walk somewhere pleasant, who could perhaps be trained up in something that would give them a new doors to open up. These are all part of upstream health and well-being. And that's really our place as a sector. And something I'm really advocating for at the moment is this upstream approach, this prevention side of things that needs to work alongside the mainstream NHS and allow the NHS to do what it does and what it is designed to do a lot more freely and without burden. And if we can prevent, slow the flow, however you want to talk about it, and tackle more upstream causes of ill health, which includes, of course, access to nature, then that's important, really. So if you go to the next slide, I know this is an academic network generally, and so we have done academic papers as well. This green publication on the left is a summary of our of some research that was basically carried out by the University of Essex between, I think, 2015 and 2019. I joined pretty much halfway through that programme. What you see there in front of you is some work by Leeds Beckett Centre for Health Promotion. And what they did was look at the evidence that the University of Essex had done through their Green Exercise Department and actually calculate a social return on investment. And those are the documents you see in front of you. And where that ended was, so this was about 2019-ish, is that regular volunteering, and again, wildlife trust volunteering, but you could apply this across all friends and partners here, shows a return of £8.50 for every pound invested. And then it found that the more targeted programs, these were sort of for those with a health or a social need, largely mental health referrals, achieved a return of £6.88 for every pound invested. Now, yes, this was based on academic research and validated scales such as the Warwick Edinburgh, and they did look at those two data sets, and there was quite a clear distinction between the types of groups that the participants joined. So that was really a helpful piece of research and economic evaluation. It's a social return on investment. And the journey we've gone on over the years as a sector is from the start, a long time ago, people say, where's the evidence? This is nonsense. You're talking tree. And then it shifted imperceptibly to how strong is your evidence? So then you take it to the next notch and you do a social return investment, and then someone goes, well, it's subjective, that's opinion. I've had that before, as someone kind of cast the report back towards me in many political meetings. So again, you think, right, okay, what is next? And so recently, in fact, before the election, we had some conversations with policy advisors from the Labour Party. We were trying to read the runes, and they basically said, well, actually, what we really could do with is something that shows cost savings to the NHS, and therefore how much something costs to run locally, how much it would save money locally, and how much that would be if you scaled it up. And that's essentially then in a very narrow and reductive way, because we know about all the health and well-being benefits and the wider conservation and biodiversity gains. That's what we did. We put out a tender to address that challenge So this is very political, frankly, and just as well, really, because we know that nature has been described earlier this week as not mission critical, and there's going to be all kinds of pressures applied to those departments. So we have to really make our way into government in as targeted and as useful a way as possible. So if we look at the next slide, the headline here is the scaled up figure. Start with that one because that's the way, and I can work back from that and tell you how we got there. But 100 million per 1.2 million people reached in cost savings to the NHS is the thing that we've obviously used in terms of socials and media and those sorts of things. So this was launched in July last year. A lot of interest in that side of things. But how did we actually go about it? So the next slide will show you really how we went about the research itself. So we did put a call out across all the trusts, but actually we carried out this work within 6 weeks from starting in around May, and then we published in July. So when we meant rapid, we really did mean rapid. So yes, how many trusts responded, but also which trust collected the data that was required, and that is kind of before and after surveys that track health outcomes, and probably that have been delivering nature prescribing programs for some time, because as I said at the start, we are a happy federation, whereas quite a spectrum. And then the research that was carried out into different approaches. So these included mental health and loneliness and physical health. These are all things that would benefit the NHS. And then the literature review in particular found the cost benefit papers. In particular, I would say Chris Dayson, who may well have spoken to you on this network from Sheffield University. He's involved in the National Green Prescribing Pilot and the local one, actually, because Sheffield has one of the local sites. And he looked at studies that considered the valuation of green prescribing services, mental health benefits, physical health benefits, and the economic implications related to reduced loneliness. And so the literature review provided those insights into those various methods that value the positive contributions of green prescribing to human health. And there were spreadsheets and things that had values on them and bed places and appointment times and those sorts of things. So it's a really thorough bits of research that have gone on. So the people we took on, I forgot to say, it was Ricardo Energy with the Institute of Occupational Medicine. They carried out this work. So health economists, another really important fact here. And then from there, you work out the cost of running the particular wildlife program. And then you can see that they carried out local evidence kind of projects, and then we chose one of those for the scaled up part. So the next slide will detail some of the local cost savings, and Wild at Heart, that's pretty much a group that targets people who are socially isolated at home, and they come to a community centre, and then they do small kind of local conservation work, but they also go on site visits, do little kind of workshops around skills development and crafting and those sorts of things. So it's definitely a loneliness kind of targeted program, but based in and around nature and other areas. Feed the Birds, so that is a program from Shropshire Wildlife Trust, which is basically a befriending model. So this is where a volunteer goes to a person who's been referred through the local health services who is at home alone and perhaps has restricted mobility. They take along all the equipment needed to feed the birds and the guides to watch them, and they sit down and they set it all up and they have a good old chat and a cup of tea, and then they leave them to it. And then a week later, they pop back, see how they're getting on. And of course, they've had a look at the birds. They're getting huge joy from that. They're learning a lot, but it's a kind of befriending program as well with the person that goes back and does those weekly visits. Nature for Health. So in Manchester, we looked at 2 programs. One, the Green Prescribing for Mental Health pilot, and another one, Lancashire Wildlife Trust have somebody embedded in the early intervention team at NHS Pennine Trust. So that means that at the triage point where an adult with mental health needs is being considered for some kind of intervention, the placement opportunity with Lancashire Wildlife Trust is at that point. So it's one of the first things that would happen where appropriate, and obviously it's done in partnership with health professionals. And so, you know, that's why it's one of those really kind of quite innovative ones, I think, because it's right at the start of that triage point. Wild Health in Gwent is one of those programs I think that all of us kind of run. It's a nature engagement one. It's skills based. There's health walks as part of it. There was quite a wrong about physical activity there. But you can see some of the issues I've had. Someone's given me feedback on this presentation saying, I think if you could just present the different cost gains and, you know, skills in a bit more of a kind of uniform, consistent way. And I said, well, I can't really, because actually they were all done quite differently. The Wild at Heart figure was the one that we scaled up, and that was the one that was looking at the 150 million that I spoke about, sorry, the 100 million for 1.2 million people. And the way that was done was it looked at the people and nature survey data and the number of people that use the natural environment for health reasons. You'll know that's one of the questions. And then they took a conservative measure in that, and then they said how many of those, looking at people's interests across a wide plethora of things, would be likely to participate in a green prescribing program. So you shave some numbers off there, and then those that specifically would benefit their mental health. And so the figure was down to 1.2 million people, and then it's just a simple calculation up from there. But I would say it is conservative, but it's still enough of a figure where you've got 635 million cost savings for a net spend of 534 million. So you're talking about 100 million. It's a nice catchy figure. But what we are talking about here is different, of course, to a social return. It's not a ratio. This is a cost benefit. Now, some of those, for example, so here you're looking at, you know, £1.19. It's absolutely extraordinary that any green prescribing activity or any green or nature-based activity has any cost savings to the NHS. So it could be that some of those are below £1, you know, sort of 79p, because it's cost benefit. But we are not actually designed to do that. These programs were not set up with that end in mind. And that's one of the critical things about the nature prescribing programs is we keep that socio model of delivering health and bringing people together. That is our strength, not that kind of medical model. But we have a huge role to play. So if we look at the next slide, the other key thing that we wanted to bring out of this was the policy asks. Oh, sorry. I've skipped a slide in my head already. This was just a couple of additional examples of additional outcomes that come from programs that aren't designed to do this. So, for example, the Feed the Birds program, this individual had a new care package put in place, but they wouldn't really let anyone else into the house. But when they came up to set a bird feeder, actually that was for a different reason. It's like when fire service fitting smoke alarms, they had a massive impact on smoking cessation, didn't they? Because doctor tells them to do it. No way. Somebody who's actually fitting a safety device in my home and said, oh, by the way, you should probably cut down and stop on those. A bit more effective. That figure there at the bottom, I think it's really worth talking about the employment outcomes from this one. 16 out of 23 of the participants on the one from the, that was the early intervention program I mentioned earlier. When they started, they reported that they were unemployed or looking for work. 16 of them out of 23 then reported that they were employed or in further kind of education post project as well. So again, there's a huge shift in some of those upstream parts of health. Now we'll go to the policy asks. So there were two key things at the end of this. The findings itself, they started, as we can see, it's nature prescribing. They save the NHS money, but they also have larger savings if they're scaled up. Because we've got quotes like taking weight out of the system, what we have called for is a joint sector approach, and that is to have shared investment funds across government departments. What we haven't done is said NHS needs to pay for community-based health or a neighbourhood-based health, as Labour might put it. And the advantage of this is you're not going to the NHS, which is already overburdened, that would have to disinvest in something solely. What you're doing is you're saying Department of Health, DEFRA, Department for Work and Pensions, Department for Transport, communities and local government, they all have an interest in upstream health and the outcomes that it achieves. And therefore, a shared investment fund that you pay into and is therefore matched by local NHS, that's a real solution. And that's a solution that's currently sitting with lottery. Partners at National Academy of Social Prescribing have submitted a report, and it's in partnership with lots of local NHS trusts. And there is confidence that 500 mil can be raised from the local NHS trusts and 500 million if it is matched by a cross-government investment fund. So you're talking about $1 billion, potentially over 10 years for starters. I think that if that happens, then that provides the engine room locally where local authorities start to come on board, private individuals, business, and it also allows critically charities like the Wildlife Trust and others to do what they do best. It's not to pay for green prescribing 100% out of a lottery program, which is what's happening at the moment across all of us. It's actually to add value to a funded part of health delivery, and it works alongside the NHS, and it prevents preventable illness. So it's an invest to save model, and that is the policy conversation that we're taking to government at the moment. It's very hard, but I think it's worth pursuing. So again, if we look at the next slide and maybe give it a couple of clicks there, Jane. This is I got quite a sort of shouty email from someone in secondary care a few months back. And she said this: I feel confused by the seeming lack of attention, this critical financial evidence by both commissioners and clinical leaders. This should be at the top of all our list because it is better for us as clinicians. And I was like, well, thank you for the email. And we had a good old conversation, and I was at pains to say that, we could have as many allies as we can in order to get this over the line. She was from secondary care, which was really interesting because most of the prescribing stuff is actually at primary care and GP levels. And there's lots of other organisations who are looking at health inequalities. For example, if you look at the Health Equals campaign, and if you start to look at organisations that are interested in nature, it is creeping up and up. So I truly think the next year or so, before the 3-year spending review in spring next year, that's when the green prescribing pilot ends. This is the time, and I think if it doesn't make it, then we've got a real issue as a sector, and actually we could be kind of convinced that this is healthcare on the cheap, and that is what I'm kind of sometimes accused of promoting. So it is really important. I am totally convinced that this is two sides of the same coin, and the more people get in, the more that nature wins. We're basically a fairly undiverse sector. There's a third of people who we're largely engaging at the moment, although that is changing, and this is one of those ways. And I think we all see, if people can see the impact of nature on their loved ones, then they'll actually benefit themselves, and they'll start to think and care more about nature. So I truly believe that's the case. We've also got other campaigns, which is really interesting, a bit more of the softer side. So we launched something called Nature Helps. So if you click to the next slide, our Vice President, Dr. Amir, will explain. Maybe click again to play him.
Guys, I'm really pleased. I've just received this postcard from a patient of mine who I recommended some time in nature to help with her mental health condition, alongside some conventional medical therapy as well. And she's written to me to tell me that she's feeling a lot better. She feels that time in nature really benefited her mental health. And it's great to receive positive feedback from the things you ask patients to do. We don't always get it. So feels good, and time in nature for my patient was a really positive thing. So I will be doing a lot more of that. I'm an advocate for it already.
Perfect. Thank you. If you click to the next one. So Amir, obviously our vice president, and has been a long ally of this, but he helpful quotes like from him and from Professor Sir Michael Marmot, who is a Labour health advisor, who's a guru on health inequalities. If any of you know Fair Society, Healthy Lives, it's a really landmark review on health inequalities. Having the health professionals, having the NHS on board, that's what made the seed change. And what he said was really interesting there in that video. We don't often get feedback when things go well. And this is really why we've got a campaign. So actually, if you go to Nature Helps, it's an online platform. You type in a message and it produces a hard copy handwritten card stamped up. We ask people if they want to contribute, but it's free if they want to. And the idea is that a hard copy postcard goes to the GP surgery. It reaches a named doctor. We've got all the GP surgeries and health clinics across the country, Great Britain. We didn't manage to get into Ulster yet, but and it sends it to that address. And if you don't know the name of the doctor, or people don't know, they have multiple doctors, and it goes to the surgery. But the idea is, can you pin it up on the board? Can people see that and just say that things have gone well? And if you haven't had a prescription, you can just write, I think this is a good idea. And we moderate all the postcards, just so you know, because we have had somebody said, it's my appointment next week and I haven't heard from my doctor. So occasionally you get the wrong, erroneous message. Normally we use Postbug, that's the platform, to bug MPs about things they haven't done. And we've used this kind of postcard, but we thought it would be good to do a positive campaign. So yep, if you click onto the next one, and then perhaps the one, this is just where we were, they're in dual language as well, and we're able to share on social media. Just a couple more slides and then I'll open up for questions. So yeah, the other one, some of you may remember this, of course. This is still about access and things like the Nature for Everyone campaign, the government's current Green in 15, whether that stays as a policy or whether it's just slightly widening out and loosening, but access is still at the heart of it. And I strongly believe these are some of the arguments that will help get us over the line. So I think that is me for now. I'm really sorry about the power cut. Thankfully, I hope it all came through quite clearly. Happy for questions now, but if anybody else wants to chat, then there's my email address as well. I'm happy to do that. Thanks, Pippa.